Thank you, everyone, for your warm introduction. My name is Youngmi Jo. I'm head of Global Affairs and Communications at IVI. So thank you very much for joining us today at this very important event to celebrate the accession of Austria, the El Salvador with the IVI. So let me then start our official event. So I'd like to invite you to watch a pre-recorded remarks provided by Mr. George Bickerstaff, the chairperson of IVI Board of Trustees. Please.
Vice Minister Dr. Carlos Gabriel Alvarenga Cardoza for Policies and Health Management, Vice Minister Ms. Adriana Mira for Foreign Affairs, Your Excellency, Jaime José López, Ambassador of El Salvador, Deputy Director General, Mr. YOO Byungseok for International Organizations and Nuclear Affairs, Ministry of Foreign Affairs of the Republic of Korea, distinguished guests and colleagues. My name is George Bickerstaff, and as chairperson of the International Vaccine Institute's Board of Trustees, it's my honor to virtually welcome you today as we celebrate El Salvador's ascension to the IVI Establishment Agreement. Nearly 1 year ago, I had the pleasure of greeting Vice Minister Adriana Mira, Ambassador Jaime José López, and Ms. Marcela Sosa in person at IVI, where we exchanged letters of interest and the Board of Trustees' approval of El Salvador's request to join. We're very proud to raise the flag of El Salvador at headquarters today to formally symbolize this new partnership, and we're particularly grateful to the Embassy of Seoul for facilitating such a smooth and collaborative process. It was clear from the first visit to IVI that the government of El Salvador was particularly keen to learn more about and to join IVI's mission to accelerate vaccines for global health. The Ministry of Health has shared with us that global collaboration is a key pillar of controlling and preventing infectious diseases, as well as greater investment in vaccine research and development. We completely agree. We look forward to continuing conversations around how IVI can not only multiply effort with El Salvador to strengthen capacity nationally, but to build across the Latin American region human resources, epidemiological and lab research, vaccine development, and a collaborative networking association. With the modernization of supply chains for vaccines and medications built into El Salvador's National Health Plan and IVI's growing membership of research projects in the region, we are well poised to make true progress and impact on the prevention and elimination of prevalent infectious diseases. On behalf of everyone at IVI, including the other 42 signatories and parties to the IVI Establish Agreement, it's my pleasure to welcome El Salvador to IVI. Thank you.
Thank you. I'd also like to inform you that Vice Minister Carlos Gabriel Alvarenga Cardoza, he visited Korea 2 years ago, November 2022. Yeah, and he met Dr. Jerome Kim, and we exchanged, how we cooperate each other, and then introduced the El Salvador's accession with IVI. So all the, this accession progress started 2 years ago with his support, and it's my honor and welcome him to provide his remarks. Yeah, today. Thank you. And Ambassador Jaime López will provide the English translation. Yeah.
Oops. Sí. Muy buenas tardes a todos. Honorable señor George Bickerstaff, presidente de la Junta del Instituto Internacional de la Vacuna del IVI. Honorable doctor Jerome King, director general del IVI. Honorable jefe de operaciones, señor François Belin. distinguidos miembros del equipo del IVI, también en virtual la honorable señora Adriana Mira, viceministra de Relaciones Exteriores de la República de El Salvador, honorable señor YOO Byungseok, subdirector general de Organismos Internacionales y Asuntos Nucleares del Ministerio de Relaciones Exteriores de Corea, distinguidos miembros de la Delegación de El Salvador en representación del despacho de la Primera Dama y del Ministerio de Salud, honorables funcionarios del gobierno de la Embajada de El Salvador en Seúl, embajador Marcela y todo su equipo que nos ha apoyado muchísimo. También a nuestros miembros del Hospital Son Chang-han y COICA también, muchas gracias. Sin ellos no hubiera sido posible la visita también, ¿verdad? Así que muchas gracias también. Y representantes del IVI, estimados colegas de las instituciones de salud en Corea y amigos presentes tanto de forma presencial como virtual.
Good afternoon. Honorable Mr. George Bickerstaff, Chairperson of the IVI Board of Trustees, Honorable Dr. Jerome Kim, Director General of the IVI, Honorable Chief Operating Officer, Mr. Francois Belin, and esteemed members of the IVI team. Honorable Ms. Adriana Mira, Vice Minister of Foreign Affairs to the Republic of El Salvador, Honorable Deputy Director General for International Organizations and Nuclear Affairs of the Ministry of Foreign Affairs to the Republic of Korea, Mr. YOO Byungseok, distinguished members of the delegation from El Salvador representing the Office of the First Lady and the Ministry of Health of the country, honorable government officials from the Embassy of El Salvador in Seoul, thank you for the support. Esteemed guests from the Sucheon Yang Hospital in Coica, this is all possible because of you, so thank you very much. IVI representatives, esteemed colleagues from health institutions in Korea, and friends both in person and joining us online.
Hoy es un día histórico para El Salvador. El estar aquí en la sede del IVE en Seúl me llena de inmenso orgullo y gratitud el ver la bandera de El Salvador izarse junto a la bandera de las naciones que se han unido en la lucha por la salud global. Esto es más que un simple gesto simbólico. Es la reafirmación de nuestra visión compartida, nuestro compromiso y nuestra responsabilidad hacia un futuro más saludable para todos. En nombre del presidente Nayib Bukele, del ministro de Salud de El Salvador y del pueblo de El Salvador y de la primera dama, deseo expresar nuestro más profundo agradecimiento por el honor de unirnos a la comunidad del IVI. Este momento refleja la dirección en la cual El Salvador está avanzando bajo el liderazgo del presidente, hacia una modernización, a un progreso científico, a un firme compromiso con la mejora de la salud pública, no solo dentro de nuestras fronteras, sino en colaboración con la comunidad global, generando un intercambio de experiencias para optimizar los recursos y mejores prácticas, trabajando conjuntamente en investigación, cambiando las realidades del mundo.
Today is a historic day for El Salvador. Standing here at the IVI headquarters in Seoul, I'm filled with immense pride and gratitude as I witness the Salvadorian flag that is going to be raised alongside the flags of nations united in the fight for global health. This is more than just a symbolic gesture. It is the reaffirmation of our shared vision, our commitment, and our responsibility toward a healthier future for all. On behalf of the President Nayib Bukele, the Ministry of Health, the people of El Salvador, the dispatch of the First Lady and the First Lady, I wish to express our deepest gratitude for the honor of joining the IVI community. This moment reflects the direction in which El Salvador is advancing under President Bukele's leadership, towards the modernization, scientific progress, a firm commitment to improving public health not only within our borders but in collaboration with the global community, sharing experiences to optimize resources and best practices in vaccinology, working together on research studies.
Al unirnos oficialmente a la familia del IVI, reconocemos el impacto clave de esta organización, que por más de 2 décadas ha liderado la investigación, el desarrollo y la capacitación en materia de vacunas. Hoy El Salvador se enorgullece de formar parte de este esfuerzo, trabajando junto con 43 miembros de la Organización Mundial de la Salud. Muchos otros actores internacionales se han unido por la misión de asegurar el acceso equitativo a vacunas. El trabajo del IVI es vital. especialmente al garantizar que las poblaciones vulnerables no queden rezagadas en la búsqueda global de la seguridad sanitaria. Desde la investigación en laboratorios sobre nuevas vacunas hasta los ensayos clínicos que priorizan a las comunidades más necesitadas, el compromiso del IVI con el desarrollo y la distribución de vacunas seguras y accesibles está alineado con los valores promovidos por El Salvador. Esta alianza, esta nueva alianza, representa no solamente un avance en nuestras estrategias de salud, sino también refuerza el papel de nuestro país en el ámbito de la salud global, trabajando por fortalecer los estudios epidemiológicos, las competencias de los recursos humanos, la investigación, la resistencia antimicrobiana y mejores prácticas de laboratorio.
By officially joining the IVI family, we recognize the key impact of this organization, which for over 2 decades has led research, development, and training in the fields of vaccines. El Salvador is proud to be a part of this effort, working alongside 43 member countries, the World Health Organization, and many other international actors united by the mission to ensure equitable access to vaccines. IV work is vital, especially in ensuring that vulnerable populations are not left behind in the global pursuit of health security. From laboratory research on new vaccines to clinical trials prioritizing the most underserved communities, IVI's commitments to the development and distribution of safe and accessible vaccines align with the values promoted by El Salvador. This new partnership represents not only an advancement in our health strategies, but it has also strengthened our country's role in the global health, strengthening epidemiological studies, enhancing the skills of our health personnel in research, antimicrobial resistance, and best laboratory practices.
Una de las grandes fortalezas del IVI radica en su capacidad para reunir conocimientos, recursos y tecnologías que pueden aplicarse a través de las fronteras. Este es precisamente el tipo de cooperación global que el gobierno de El Salvador busca fomentar. El presidente ha enfatizado durante mucho tiempo la importancia de las alianzas internacionales y la ceremonia que hoy tenemos es precisamente la prueba de esto. La seguridad sanitaria solo se puede lograr a través de la solidaridad. Estamos entusiasmados de contribuir y beneficiarnos del trabajo conjunto y las iniciativas conjuntas con el IVI, transferencia de tecnología, asociaciones público-privadas. Las actividades son fundamentales para garantizar que las naciones en desarrollo sean partícipes activos en la generación de nuevas tecnologías. Nuestro país tiene el potencial de ser un centro de progreso científico y estamos ansiosos por fomentar la colaboración con actores globales y regionales, iniciar el camino para el desarrollo de productos biológicos.
One of IVI's great strengths lies in the ability to bring together knowledge, resources, and technologies that can be applied across borders. This is precisely the kind of global cooperation that the government of El Salvador seeks to promote. President Bukele has long emphasized the importance of international partnerships, and today's ceremony is a proof of that. Health security can only be achieved through solidarity. We are excited to contribute to and benefit from IVI's initiative related to technological transfer, public-private partnerships, vaccine commercialization. These activities are essential to ensuring that developing nations are active participants in the creation of new technologies. Our country has the potential to be a hub of scientific progress, and we are eager to foster collaboration with global and regional actors, initiating the path for the development of biological products.
Por último, valoramos profundamente las oportunidades de capacitación que ofrece el IVI, tanto a través de programas como invitaciones a Corea como tal, al fortalecimiento de las capacidades técnicas y operativas de nuestros trabajadores de la salud e investigadores. Estamos invirtiendo en el futuro donde El Salvador esté mejor preparado para responder a las emergencias de salud, a desarrollar y distribuir vacunas, a contribuir al conocimiento en salud global. Quiero reiterar el inmenso orgullo que sentimos como nación de ser parte de esta misión. Estamos comprometidos a trabajar estrechamente con el IVI bajo la guía del Dr. Jaime King y con todos los países miembros. Gracias a todos por hacer esto posible Que esta colaboración prospere por muchos años y que sigamos trabajando juntos por un mundo en el que cada persona tenga acceso a las tecnologías de calidad y accesibles, principalmente las vacunas. Muchas gracias a todos.
Additionally, we deeply value the training opportunities offered by IVI, both through programs involving invitations to Korea and on-site visit. By strengthening the technical and operational capabilities of our health workers and researchers, we are investing in a future where El Salvador is better prepared to respond to health emergencies, develop and distribute vaccines, contribute to global health knowledge. Finally, I want to reiterate the immense pride we feel as a nation in being part of this mission. We are committed to working closely with IVI under the leadership of Dr. Jerome Kim and with all the member countries. Thank you all for making this possible. May this collaboration thrive for many years, and may we continue to work together for a world where everyone has access to quality and affordable vaccines. Thank you very much.
Thank you very much, Vice Minister Alvarenga and Ambassador Lopez. By completing today's accession ceremony, El Salvador becomes IVI's 27th official parties to the IVI Establishment Agreement. And then by joining this group, the El Salvador will be part of IVI Global Council as well. So we would like to include all the recommendation Vice Minister provided today into our Global Council discussion, and then this is kind of starting point to we continue our next collaboration. Thank you very much. And next, we have pre-recorded remarks by Vice Minister Adriana Maria Mira de Pereira, Vice Minister of Foreign Affairs of El Salvador. And as Mr. Bickerstaff already mentioned, she also visited IVI last year, and we discussed lots of ways to how we collaborate each other. So it's a great honor to have her remarks as well. Please. Yeah.
Today is an historic day for El Salvador, in which we reaffirm our commitment to global public health and scientific innovation by officially joining the International Vaccine Institute. This step represents not only an opportunity for our nation, but also a responsibility that we assume with great dedication and hope. El Salvador knows the importance of being part of this global effort. Our membership in the International Vaccine Institute is an example of our conviction that in order to meet the health challenges of the future, we must work together. With this incorporation, El Salvador will seek to promote projects of training, access and transfer of technologies, generation of new capacities, cooperation and financing programs, use of platform and contacts with industry leaders, among others, to work for the benefit of the population and the progress of the region. I am deeply grateful to Dr. Jerome Kim, Director General of the International Vaccine Institute, and to Mr. George Bickerstaff, Chairman of the Board of the Directors of the International Vaccine Institute, and in general to the entire IVI team for this support in our country's accession process. It is a source of pride that, at the end of this ceremony, the flag of El Salvador will be flown as such a prestigious institute, along with the flags of the other member countries. I would also like to express my sincere gratitude to the Technical Committee of the International Vaccine Institute and the National Technical Committee, as well as all the teams involved in the accession process. We recognize the tireless work that the Institute has done for global health, and we look forward to actively contributing to its mission. In El Salvador, we are committed to strengthening our capacities in vaccine research, production, and distribution. We know that the health of our citizens depends on the ability to act quickly and effectively on the face of emergency threats. This commitment is not only to our own population, but to all humanity. Finally, on behalf of the Salvadorian people, I reiterated our vow to work tirelessly to improve global health and to face together the challenges that the future holds. This is a journey we embark on with humility, knowing that success will be the result of our collective efforts. Thank you all for giving us this wonderful welcome.
Thank you, Vice Minister Mira, and it's really meaningful to have her remarks as well. So now I'd like to welcome Mr. YOO Byungseok, the Deputy Director General for International Organizations and Nuclear Affairs from the Ministry of Foreign Affairs of Republic of the Korea. Korea is IVI's host country, so we welcome his remarks.
Thank you, Dr. Carlos Gabriel Alvarenga Cardoza, Vice Minister of Health of El Salvador, and His Excellency Jaime José López Badia, Ambassador of El Salvador, Mr. François Blanc, Deputy Director General of IVI, distinguished guests, ladies and gentlemen. It is my great pleasure and privilege to join you in celebrating the accession of the Republic of El Salvador to the International Vaccine Institute. On behalf of the government of the Republic of Korea, I'd like to convey my sincere congratulations to El Salvador for its admission as a member of IVI. As she explained, you are 27th state party to the IVI. Korea, which hosts IVI headquarters, has been a vocal advocate of its expansion in the global architecture. Korea fully acknowledges and appreciates IVI's indispensable role in developing safe, affordable, and effective vaccines and delivering them to partner countries, as well as in facilitating capacity building of these countries. In this regard, we commend IVI's recent efforts to expand its global reach through the opening of a new regional office in Africa, the second of its kind following the opening of the Europe regional office in 2022. We hope that these offices run smoothly and effectively in support of IVI's mission. I'm confident that El Salvador's accession to the IVI will give a further boost to IVI's global expansion. This will provide a great opportunity to build stronger partnerships with countries in Latin America, a region with a lot of potential for future collaboration with the IVI. For our part, Korea is supporting the development of El Salvador's healthcare system through various COICA projects, such as the establishment of the National Health Education Center and capacity building for health professionals. I'm happy to see COICA and Suncheonyang University staff joining us here. I believe they are working on COICA project, right? So thank you for your hard work. And I hope that Korea and El Salvador will be able to further our cooperation in the field of health through bilateral and multilateral channels, including within the framework of IVI. We cannot overemphasize the importance of international solidarity and cooperation in addressing global public health issues. As we have seen during the COVID-19 pandemic, and Ambassador, you just mentioned when we had a conversation outside, health crisis knows no borders. This underscores the need for the international community to work together to be well prepared for future global health threats. To this end, Korea will continue to support IVI's efforts to advance global health security and to work closely with other state parties, including El Salvador. Once again, I extend my heartfelt congratulations to El Salvador and IVI on their new journey together. Thank you very much.
Thank you, Mr. Yu, for your warm words of congratulations. So next, we have pre-recorded remarks by Dr. Jerome Kim, Director General of IVI. Unfortunately, he couldn't join this important ceremony in person, but he provided his remarks as pre-recorded. So please.
Vice Minister Dr. Carlos Gabriel Alvarenga Cardoza for Policies and Health Management, Vice Minister Ms. Adriana Mira for Foreign Affairs, Your Excellency, Jaime José López, Ambassador of El Salvador, Deputy Director General Mr. YOO Byungseok for International Organizations and Nuclear Affairs, Ministry of Foreign Affairs of the Republic of Korea. Distinguished guests and colleagues, my name is Jerome Kim, and I am the Director General of the International Vaccine Institute, or IVI. My apologies for being unable to attend today's ceremony, but it is my honor to speak to you today about the significance of El Salvador's accession to IVI. El Salvador exemplifies the values of IVI and its member states, namely a shared commitment to end suffering caused by vaccine-preventable infectious diseases by harnessing the power of vaccines to protect the lives of people. In El Salvador, people have a high confidence in vaccines, and the government has achieved a high rate of vaccination through its expanded program on immunization. Nevertheless, El Salvador continues to improve and expand public vaccination. In 2020, El Salvador added HPV vaccines to its national vaccination schedule and initiated a national vaccination campaign to prevent cervical cancer, the second most common cause of cancer in women and girls in El Salvador. In response to the COVID-19 pandemic, Salvadoran officials worked tirelessly to secure COVID-19 vaccine from suppliers around the world. As a result, over 70% of El Salvador's population received at least one dose of COVID-19 vaccine, exceeding the vaccination goals set by the World Health Organization. El Salvador even became a practitioner of vaccine diplomacy, donating 34,000 doses of COVID-19 vaccines to communities in neighboring Honduras. As a part of El Salvador's development strategy, the country is pursuing a plan to strengthen its capacities in health and technological innovation. To that end, Salvadoran researchers have received training from IVI through the Korean Ministry of Health and Welfare / WHO Global Training Hub for Biomanufacturing. In Latin America, IVI previously worked on preparation for the introduction of dengue vaccines, and we are currently conducting clinical trials on a new vaccine against chikungunya. Both dengue and chikungunya pose a significant burden in El Salvador, and we believe that additional collaboration. In Latin America, IVI previously worked on preparation for the introduction of dengue vaccines, and we are currently conducting clinical trials on a new vaccine against chikungunya. Both dengue and chikungunya pose a significant burden in El Salvador, and we believe that additional collaboration with IVI will help El Salvador tackle these and other infectious disease threats. At IVI, we hope that today's flag-raising ceremony will mark the beginning of a new partnership between El Salvador and IVI that will further strengthen our collective efforts to combat infectious diseases. Thank you.
Thank you, Dr. Kim. Now, let me invite Mr. Francois Blanc, IVI's CFO and the Deputy Director General of Finance and Operations, to provide the IVI introduction.
Thank you. Thank you. So, I get it. Okay. So, Vice Minister Dr. Carlos Gabriel Alvarenga Cardoza for Policies and Health Management, Vice Minister Ms. Adriana Mira from Foreign Affairs, Your Excellency Jaime José López, Ambassador of El Salvador, Deputy Director General Mr. YOO Byungseok for International Organizations and Nuclear Affairs, Ministry of Foreign Affairs of the Republic of Korea, distinguished guests, colleagues, and friends of IVI. It is my great pleasure to welcome you and introduce the activities of the International Vaccine Institute as we celebrate El Salvador's accession to the IVI establishment today. So I will give you a short introduction on IVI. So who are we? IVI is an UN-chartered international organization which is dedicated to accelerating vaccine R&D for global health. So you see our mission is very important, is to discover, develop, and deliver safe, effective, and affordable vaccines to enable the world's most vulnerable people to have full, productive lives. So it's very vast. The next step is to expand our global presence and expand our collaborative partnerships and innovative capabilities. And together, we can achieve our vision of developing countries free of suffering from infectious diseases. So IVI is truly an international organization that has worked across multiple regions. As you can see, we have field programs in basically more than 50 sites and in more than 30 countries across Asia, Africa, Latin America. In IVI, more or less, we are 260, and we have 26 nationalities working in IVI. We are OECD recognized as an international organization, and we are, of course, very importantly, not-for-profit. We have 42 countries, it was mentioned, and WHO as state parties and signatories. And then we have 13 countries who are on the pathway to accession. So it's a bit heavy administrative process. So we have 13 countries that are in the middle. This is the list of the flags. So we hope to continue to add more. So basically, let me go down now into our strategic roadmap. So we have a strategy for the 5 years, 22-26. And as you can see, of course, what is guiding us is the vision and the mission. So we have different aspects. So you can see that what we do, our pillars, there's first, we are a research institute, and we have a lab here doing very advanced research. But then we also are a product development organization which covers vaccine development, epidemiologies and surveillance, and vaccine effectiveness. And finally, we are also an international organization. So we are really 3 into 1. And we strengthen the global vaccine community through international cooperation and education. And our strategy is basically to amplify the core and pursue opportunistic actions, which is basically to do more of what we are doing already. But we want also to scale the global footprint to international expansion, and then work on our future-proof governance, meaning improving our governance as the challenges become more complex. Where do we work? So here you have a good view. Basically, we work a little bit everywhere, but we opened a Europe regional office in Sweden in 2022. And we are opening a Global Health Institute in Hong Kong. And then we have also collaborating centers in Ghana, Madagascar, Ethiopia. We are opening a regional office in Rwanda, Kigali, and a project office in Nairobi, Kenya. So you can see that we have a scope of over 100 projects in 44 sites and, giving work to 1,000 persons. From a number perspective, so our progress you can see from this chart. So our expenses, meaning our activity, is now above $100 million. This is the amount of spending that we do that is dedicated to global health. If you look specifically the funding of our projects, you can see that we managed to diversify over the last many years from 2015. So we diversified our source of funding. We went from 17 to 88 million. And for instance, BMGF was 75% in 2015, and is now only 15%. So we added a lot of new global funders to the support of BMGF. And regarding the portfolio of diseases, you can see that in fact we were very centered about many 3-4 big diseases, but now we have a scope that is much wider than it ever was. So just to go in detail, I'm not going to go through that, but what we do, so it's just important to see that IVI is present across the whole development, the supply chain, all the vaccine supply chain. So we discover, we develop, we deliver, and then we do surveillance of the whole. So this is for a reading when we have more time. But you can see the list of activities that IVI is performing with just 260 staff. In a nutshell, IVI brings affordable innovation to global health. You have in mind, people say to develop a new drug or a vaccine, it takes $1 billion. So, well, IVI developed the oral cholera vaccine with $28 million. It costed only $28 million. The cost for the vaccine number 2, typhoid, is also around $29 million. And we are working on another one, non-typhoidal salmonella and shigella, with just a short, small amount. So really, it's very cost-effective innovation that IVI is championing. We are leveraging our collaboration. So basically what we do is collaborating. Collaborations is the name of the game. We have 160 government entities, universities, companies, global health groups, and philanthropies. And at every stage of the vaccine supply chain, there is a lot of collaborations that have to happen to end up to a successful vaccine pre-qualification. So this is just an overview to give you an idea of the scope. And also we need to strengthen R&D and manufacturing capacity in low and middle income countries. So this is training and education, this is Global Health Strategic Working Group, and also technology transfer. So we are very present in each of these fields as part of our strategy. The new initiatives, I alluded to them before. We are setting up a regional office in Africa, and also in Rwanda, and also we are setting up in Kenya an office which is at the same time a project office, a project coordination office, and also a country office. So these are really important projects for IVI. We are also setting up this Hong Kong Jockey Club Global Health Institute. So this is in the making, but again, we should be able to attract significant funding from Hong Kong and be able to support global health with this. We have also overall looking, we are always looking at impact. And, so people say, okay, everything you do is fine, but what is the impact? So we try to put it on this slide. So we have participated 150 plus million doses of first ever low cost oral cholera vaccine that have been shipped, 150 million doses. We have completed 180 plus projects since 2015, and to the list, but 5 vaccine products have been pre-qualified by the WHO, and the training, 8,000 professionals have been trained on site and online, and we are continuously, our scientists are making publications, and we are continuously doing that. So 1,400 plus publications and 625 since 2015. So in closing, I would say that today's ceremony marks the beginning of a crucial partnership between IVI and El Salvador. At IVI, we believe that partnerships like these drive progress, allowing us to jointly address the most pressing health challenges. With El Salvador's accession, we are confident that together we can accelerate the development of life-saving medicines, vaccines, and expand the impact of global immunization efforts. We look forward to many successful collaborations with El Salvador, strengthening our shared mission to combat infectious diseases through science, innovation, and cooperation. Thank you.
Thank you, Francois, for your introduction. This concludes the first part of the ceremony, which is now held in auditorium. Now we will move to the next highlight of this ceremony, photo taking and also flag raising of El Salvador's flag. And before we concluding this first session, I'd like to express our sincere appreciation to Ambassador Lopez and also Ms. Sosa and Embassy for your enormous support in making this happen. And 2 years is actually standard and very short period for completing accession, and really greatly appreciate your full support for that. And let me then invite everyone to go out in the. Okay, yeah, of course. Yeah, we can do that here.
I'm sorry, could we ask you for...
Let me give you also IVI, so you can give stuff to remind you. Thank you. Thank you. Thank you. Thank you.
Mr. Yu, I'm sorry. Yes.
Thank you.
And it's a little bit of coffee. It's a handicraft made in South.
Thank you. Oh, no. Thank you for coming. Thank you.
Mr. We wanted to deliver one to Mr. Bickerstaff.
So as I said, Mr. Bickerstaff
It's coming next week.
Okay.
That's amazing.
Thank you.
George.
Yes.
And also
Yeah.
Jerome and
Thank you.
Okay, thank you so much. And then now, please, proceed to the lobby for photo taking, and then next to outside courtyard for a flag raising ceremony. Thank you very much.